the popular insulin pumps? And my answer to this question is, it is never ever going to be a complete replacement. But of course, the connected insulin pens are superior to the conventional syringes and insulin pens. That we need to agree. And how do you classify the connected insulin pens? The insulin connected pens can be classified into number one, TIP. And these are the tracking insulin pens. And number two, the SIP or smart insulin pens. And then you have the smart insulin caps. I will very, very briefly in the next 10 or 12 minutes go through the history and also the details. And what is the history? When did we first have the insulin pens in the global market? And this was way back in 1985 when Novo pen was launched and many followed. And in 2007, the pen with the memory function was marketed. So just showing the memory of the insulin which is delivered. In 2014, there is another version of the same pen, and there is enhanced insulin pen cap. And the caps are still developed by many others. And this is the third component of the connected insulin pen. And then you have in 2017, another remarkable innovation. The US FDA approved the reusable smart insulin pen. So the smart insulin pen is quite different from the conventional connected insulin pen. So what are these smart insulin pens? So they have the connectivity. And the connectivity is via the Bluetooth. And usually it is a Bluetooth low energy so that it can save the battery life. Or it can be in addition to via the NFC, that is near field communication. The picture you can see a Novo Pen 6 getting manually connected to your mobile phone, which is NFC enabled. The pen is also NFC enabled. And the data is transferred via this application to the mobile phone application. And it can be digitally stored. It can be stored in the cloud, for example, in the glucose. And similar to what we have listened to Dr. Sambita, similar to the stages of evolution of an automated insulin delivery system with an insulin pump, we do have a similar staging with connected insulin pens. And stage 0, unfortunately, we are still at stage 0 in India. And these are the usual pens. And in stage 1, we have the tracking insulin pen. Retrospectively, the dose is documented in the pen. And in stage 2 of a tracking insulin pen, it is a real time. In addition, you have the insulin on board data. The data is stored in the cloud. In stage 3, and that is the final stage with tracking insulin pen, it is integrated with diabetes management systems. You can retrieve the information. You have the insulin doses, the carb, and then you have the CGM data against this. And in stage 4 and 5, remember, these are the smart insulin pens. And this comes with the dose calculator. It can even detect the priming of the dose so that it is abstracted from the insulin on board, or it can prevent the insulin stacking, can efficiently prevent hypoglycemia. And then you can have different settings such as ICR, the insulin sensitivity factor. And these are all very similar to what is happening with an insulin pen for more than 50 years. And in the final stage where we are now, it comes with an additional setting for the weight of the person. And then it can even provide you with customized coaching and education, can deliver the modules. And this is probably one of those examples of an advanced decision support system. So the smart insulin pens are also rapidly advancing. So this is from Novo. There are 2 insulin pens. These are not available in the Indian market. One for adults, that is Novo Pen 6, and the other one, the colored one, is the next version of Echo, that is a Novo Pen Echo Plus, meant for children, the pediatric population, which has got the ability for 0.5 dosing, that is half unit dosing. But in addition, you can see that over the pen cap, you have the memory of the last delivered bolus, or even the basal. You can use the same for even Tresiba or for long-acting insulins. And then the duration from the last injection, it stores 800 injection memory. And the battery, it has got a life of 5 years. And it is also NFC enabled. So another one which is approved by the US FDA, cleared by the US FDA, is Bigfoot Unity. So we have been listening to Bigfoot for more than 20 years now. And this is an integrated diabetes management system, which can be used along with either a basal or a bolus. So what is special about Bigfoot Unity? This is again an example of how an insulin cap can be integrated with other pens. And the cap can be used as a reader or an NFC-enabled phone. You can scan the Libre reader with this, and the data is captured by the insulin pen over there, and it will automatically suggest you. It is there on the display over the insulin pen cap itself, the dose which need to be delivered. So that is quite amazing. The cap in the pen itself is suggesting you the dose of the insulin to be delivered. So what are the clinical features or the merits of a connected insulin pen? If you are a believer of precision diabetology, this is again an example of how precision can be ensured when you are using a delivery system for insulin. And another one, delivering the right dose at the right time. There is no question of missing a bolus. It will remind you if a bolus is missed or if it is mismatched. And it is also having the provision to integrate with other diabetes-related data and also capable of informing you with therapy decisions. And for the doctor as well as for the physician and for the patient, it helps you overcome the major challenge. I would say that the major challenge in diabetes is overcoming the therapeutic inertia. And some of these connected pens are also enabled for sensing the temperature of insulin. It will give an alert if it is exceeding the temperature. It can also provide you with an alert if the insulin is expired or the cartridge need to be replaced. And if you are unsure whether you have bolus or not, then you can check in the mobile phone application and the data will be there. And this is how it is transforming from Diasen to Gluco. Not available in India, but popular all over the world, a data management system where you can download the information from a insulin pump or from a glucometer or a CGM device, and including from the smart insulin pens. And this is also helping patients for a long time, and also the hospitals to probably increase the time in range. So now diabetes management all about percentage time in range and the TR metrics. So let us now have a glance on how the connected insulin pens are improving the TAR. And this is a study among 94 patients. This is with Novo Echo Plus and with Novo Pen 6, type 1 diabetes subjects using a CGM and a basal bolus insulin regimen. And with connected insulin pens, the TAR increased by around 1.9 hours per day. And the level 2 hyperglycemia, that is below 54 milligrams per deciliter, again reduced by 0.3 hours per day. And that is significant, very, very significant, both statistically and clinically. And there is a significant reduction even for the time spent in hyperglycemia. And what is it? MPD, very important in a basal bolus regimen in type 1 as well as in type 2 diabetes, missed bolus doses. And that is very, very common. And with the use of connected insulin pens with remainder functions, the missed bolus doses were reduced by 43%. So with the use of advanced user-friendly technology such as with the smart insulin pens, there is significantly more time spent in range, and there is a significant reduction in the missed meal boluses. And this is how it has evolved. For those of you interested in going through the history of evolution, and this is the history for the last 100 years, ever since the discovery of insulin, the insulin delivery devices are also advancing. And this review from India, this has been referred to by the ADA, by the AS in their clinical practice guidelines as well. And moving on to a detailed discussion, smart insulin pen. And this is in pen. Originally, it was actually a property of another company. This is now acquired by Medtronic. And this is a reusable pen, automatically capturing the meal dosing. So you need not manually put anything. And the data is automatically logged in. It prevents insulin stacking. But what is special? You can see that it is giving a reminder function. Did you miss your breakfast dose? And this can appear on your Apple Watch or on a smartwatch so that you will never miss a dose. And this is connecting via Bluetooth. And you can see that there is CGM at the bottom and the insulin kinetics at the top. It helps take some of the mental math out of the diabetes management. So it can itself automatically suggest the dosages of insulin to be delivered and considers insulin on board. But you have to manually, but that is important for InPen. With InPen users, you have to manually log in the data pertaining to the long-acting insulin. And it currently works with all the rapid-acting insulins. So the SIPs, so again, this is what which is shown on the picture is InPen, originally from Companion, and now with Medtronic connects to Guardian sensors as well. The SIP dose calculator offers support for those on simpler but less precise fixed mealtime dosing regimens, and counting the carbohydrates using the insulin carb ratio. And it is precise to even a decimal point. Over 4 time periods, we can change your insulin carb ratio, the insulin sensitivity factor, the variations related to the eating habits, menstruation, physical activity, and so on. So many of these are similar to the settings in an advanced smart insulin pump. And this has to go through the ISO standard. So what is the ISO standard for the connected insulin pen? So 15187 is the standard for the glucose meters. And here it is ISO 116081. And this is considering the accuracy for extremes of temperature, for extremes of humidity, for extremes of vibration, exposure to dust, and even to the moisture. It needs to be stable. So when will you recommend connected insulin pens? You can recommend connected insulin pens for those with recurrent episodes of hypo, repeated hospital admissions for uncontrolled diabetes, a glycemic variability which is sufficient enough to result in mood swings, psychological distress or depression, very common. Those who are repeatedly forgetting the bolus before a meal, those are having difficulty in mathematics, carb counting, because the pen is helping you, the app is helping you a little bit with the mathematics, and elderly who are living alone, and of course, children with type 1 diabetes, a large population who cannot afford or who are not comfortable with the use of insulin pump therapies, and women who are pregnant with diabetes. And these are also useful for those who are caregivers for people with diabetes, because it is much more convenient, and also for in-hospital use. And look at the global market. The global market for smart insulin pens, it is steadily growing. And if you look at the segment, it is in 2021, it has got a market size of US dollars 97.6 million against $306 million in 2030. And in 2021, the home care settings, that is a home care settings segment, has actually contributed to 25% of the market share. So it is steadily growing globally. And the US FDA has also started approving some of the smart pen caps in addition to the smart insulin pens. And this is the Malia medical device, a smart sensor which can be attached to either an insulin pen delivering a long-acting insulin or a rapid-acting insulin. But very recently, this is also getting approved for use with GLP-1 based pens. So that is amazing. So in conclusion, my dear friends, the future of diabetes will be heavily dependent on the use of technologies. And this is because of the reason that most of the patients are finding it very useful with better outcomes, much better outcomes. And number two, the clinicians like us cannot shy away, because the use of technologies is going to be very, very useful. And this probably will be the one which is benefiting those below the age of 40 years, because below the age of 40 years, most of the patients consider the use of technologies and a mobile health application, a user-friendly M-health application